Hi guys, welcome to our Sureshot series. Today we are going to discuss about the glaucoma and also its types and what are the different therapies that we can give for this patient. And this is one of the most important topic for your FMG and the NEETPG. So before we dig into the topic, I want you guys to subscribe and share with your friends. So before we know about the pathology of the glaucoma, we should understand what is the normal pathway of the aqueous humor. So let's understand the aqueous humor pathway. So we all know that the aqueous humor is produced from your ciliary bodies in the posterior chamber. So after producing in the posterior chamber, this will enter through the pupil and it will enter into the anterior chamber. So this aqueous humor has the two pathways to enter. One is your trabecular outflow, which is 90%. Another one is a short pathway, uveoscleral outflow, only 10%. So after entering into the these kind of trabecular meshwork, it will enter into the canal of Schlum. After this, it will directly enter into the systemic circulation. So this is the one of the major outflow of the aqueous humor. And another one is the uveous sclera. And how this uveous sclera will be contained? So through the uvea and the sclera, it will enter into the systemic circulation. So this is how the aqueous humor and its production and the outflow is seen. So what is happening in the glaucoma condition? We are going to discuss now. So let's understand the open angle glaucoma. What is the open angle glaucoma? We all know that after producing from the ciliary bodies, this will enter through pupil into the trabecular meshwork and also uveoscleral pathway. But what happening in the open angle glaucoma? Your trabecular meshwork is completely blocked. Okay, so the trabecular outflow is a resistant, but still the angle is open. So the outflow which is coming from the pupil is clear and the outflow in the anterior chamber is also normal. But there is a resistance in the trabecular meshwork. So this is what happening into the open angle glaucoma. Angle closure glaucoma. In this angle closure glaucoma, you can see the trabecular meshwork is completely closed, and also your uveoscleral pathway is also closed. So this is what happening in the drainage pathways obstruction. But why this drainage pathways obstruction is happening? Due to your pupillary block. So we all know that after producing from the ciliary body, it should enter through the pupil. But here you can see your pupil is completely blocked. So this is why the drainage in the posterior chamber is increasing and increasing. Your intraocular pressure is also increasing. So this is what happening between the angle open angle glaucoma and also angle closure glaucoma. Primary open angle glaucoma is mostly seen in the chronic patients, old age people, and mostly due to the family history of the patients in the glaucoma. And this is seen with the symptoms like headache, and also patients will be presenting with the dark adaptation as soon. And also on the retinoscopy, you will be seeing the bio-knitting sign. And how the bio-knitting sign is seen on the optic disc, you will be seeing this kind of sign. And also the patients, those who are presenting with the primary open angle glaucoma, they're likely to be end up with the loss of vision. So what is the drug of the choice that we can give for this patient? That is, the drug of the choice is latanoprost. Okay, we'll understand the mechanism and side effects later. So the ultimate treatment for this patient is a trabeculoplasty. The primary angle closure glaucoma. So this is seen in the acute patients and regardless of the age, mostly in the younger patients. And also the presentation symptoms of this patient is a severe eye pain. Okay, the patients will be presenting with a severe eye pain, and when you check the intraocular pressure, this is more than 40 mmHg. Okay, when it is comes to the open angle glaucoma, this is likely to be only more than 10 to 20 mmHg only. See on the examination, these patients will be having the severe redness in the eye, and also rock hard kind of eye will be presented in this patient. And there is a specific triad present in the closer type, that is your Oakes triad. And what is the presentation of the Oakes triad? There is a iris atrophy and also dilated pupil, and the patients will be having the posterior syncytia. And what is the drug of the choice for this patient? Immediately you have to give the mannitol for this patient. And the ultimate treatment for this patient is a laser iodotomy. Okay, so this is what your difference between the open angle glaucoma and also the closure angle glaucoma. So let's understand what are the different types of the drugs, mechanism of action, and side effects. So So let's start with the prostaglandin F2 alpha analogs. So they are the example of the latinoprost as we discussed above. This is the drug of the choice for your open angle glaucoma. And how the mechanism is working? This will increase the uveoscleral pathway. We already discussed there are two normal pathway. One is your trabecular pathway and other one is the uveoscleral pathway. So open angle glaucoma, the trabecular pathway is blocked. So that way we are going to increase the uveoscleral pathway in this patient. But there are specific side effects presented. That is one of the hypertrichosis in this patient. Another one is the iris pigmentation. And uveitis will be seen, and also cystoid macular edema. Now coming to the beta blockers, this will decrease the aqueous humor production. So either we have to increase the outflow or we have to decrease the production. So the beta blocker is going to decrease the aqueous humor production. So your drugs are timolol. Okay, one of the drug is timolol. And what are the side effects in this patient? Corneal anesthesia, blepharoconjunctivitis, and also nasolacrimal duct blockage. Next, coming to the alpha agonist. In the alpha agonist, we have the two types of drugs. One is your aproclonidine and also brimonidine. Agonist has the two roles. It will decrease the aqueous production and will also increase the uveoscleral pathway. What are the side effects of the alpha agonist? We have the two types of drug. One is your aproclonidine. So this will be having the patients with the eyelid retraction and also follicular conjunctivitis. And mydriasis is seen in this patient. Brominidine. So brominidine will cross the blood-brain barrier. This will cause the apnea in the patients and also depression and drowsiness. So that's why when we are giving the brominidine, we should concern that this is contraindicated in children. All right. Next, moving on to the miscellaneous drugs, we have the carbonic anhydrase drugs. Those are your acetozolamide. Okay, this is the Dimox that we can give the patient, and this is the orally given drug for your acute closure glaucoma, and this will decrease the aqueous production. And what are the side effects? Mostly this patient will be having the metabolic acidosis, and also when we give the patient with the orally, there is a high risk of the TA2, and also patient can land into the sulfa allergy. And next, moving on to the another type of the drug, that is your myotics. Or mostly the myotics that we can give is the pilocarpine, and pilocarpine usually also preferred in the patients with the closure angle glaucoma. So this will also decrease the aqueous production in the patient. So after that, there is a high chance that the patient can have the brow ache. Okay, the eyebrow can be having the pain and also meiosis, and rarely this patient can also see the retinal detachment, which is rarely seen in this patient. And the last one, that is your rho kinase inhibitors. So in the rho kinase inhibitors, these patients dip. So rho kinase inhibitors will decrease the aqueous production and also it will increase the trabecular flow. Okay, and these patients likely to have the verticillata. Okay, there is a rare chance the side effects can be seen, and usually commonly there is a hyperemia post giving this drug is noted. So these are the commonly used drugs in your anti-glaucoma therapy. So happy preparation, guy. I hope you understand, and please do subscribe and share with your friends.